Good afternoon, and thank you once again for joining us. I'll start with the usual update on today's statistics. The total number of positive cases reported yesterday was 543. That represents 2.6% of the total number of tests and takes the total number of confirmed cases in Scotland to 203,555. 150 of those cases are in Greater Glasgow and Clyde, 77 in Lothian and 102 in Lanarkshire. The remaining cases are spread across 8 other health board areas. 750 people are currently in hospital, that is 34 less than yesterday, and 69 people are in intensive care, which is a reduction of 2 from yesterday. And 35 additional deaths have been registered in the last 24 hours of patients who first tested positive over the previous 28 days. As you will know, we report the number of deaths associated with COVID-19 in 2 different ways. Each week, the National Registers of Scotland reports on deaths where COVID-19 has been listed on the death certificate. And each day, Public Health Scotland reports on the number of people whose death was registered in the previous 24 hours and who had first tested positive within the last 28 days. Through quality assurance work, Public Health Scotland has identified 172 cases where a person was recorded in the weekly NRS figures but should also have been recorded in the daily figures. Public Health Scotland produces the daily figures by reconciling the reports it receives each day from National Records of Scotland with the information on its own database. For these 172 deaths, Public Health Scotland had not been able to identify an individual's unique NHS Community Health Index or CHI number. Public Health Scotland have now put systems in place and now expect to be able to reconcile all cases each day, even when it doesn't have the relevant CHI number. This should mean that further revisions will not be required in the future. The 172 additional deaths Public Health Scotland are reporting today, together with the 35 which were recorded yesterday, means that the total number of deaths registered under the daily measurement is now 7,371. National Records of Scotland has also just published its weekly update, which includes cases where COVID is a suspected or contributory cause of death. Today's update shows that by last Sunday, the total number of registered deaths linked to COVID under that wider definition was 9,580. 227 of those deaths were registered last week. That is 64 fewer than in the previous week, a fall of more than 1/5, and represents a reduction of almost 50% since the 3rd week of January. Of the deaths registered last week, 187 were in hospital, 26 in care homes, and 14 were at home or in a non-institutional setting. So deaths in care homes continue to decline significantly, and last week made up just over 11% of all COVID deaths. This does provide further evidence that vaccination may be reducing the number of people dying from COVID. But even so, the virus is still bringing grief and heartbreak to households on a daily basis. And once again, I want to send my condolences to all those who've lost a loved one. I'm joined today by Dr. Gregor Smith, our Chief Medical Officer, who will help me to answer questions. But before then, I have 3 points that I want to highlight. First, I can provide more details on our vaccination programme. As of 8:30 this morning, 1,661,879 people in Scotland have received their first dose of the vaccine. That's an increase of 27,518 since yesterday. In addition, 8,105 people received second doses yesterday, meaning that a total of 35,623 vaccinations were administered. Just under half of all care home residents have now received their second dose. In addition, 95% of 65 to 69-year-olds have now received a first dose, 36% of 60 to 64-year-olds, 30% of 55 to 59-year-olds, and 25% of 50 to 54-year-olds have all received their first dose. So if supplies continue to allow, we still expect to be able to offer a first dose of the vaccine by the middle of April to all those aged 50 and over, all unpaid carers, and all adults with particular underlying health conditions. The second point I want to highlight is to underline some of the key elements of the plan that the First Minister set out in Parliament yesterday, enabling children to return to school. All children in primary 4 to 7 will go back to school full-time from Monday the 15th of March, unless new evidence or new circumstances force us to reconsider. We will also take steps in a phased return to secondary school from the 15th of March, with a clear expectation that all secondary school pupils will be back in school on a full-time basis after the Easter holidays. However, it is the intention that all secondary school pupils will return to spend some time in school between the 15th of March until the Easter break. Students in the senior phase of secondary school, that is years 4 to 6, who are taking a national qualification, will have priority for face-to-face lessons in school. Education Scotland is producing guidance this week to help local authorities deliver education during that phased return before Easter, but local authorities will have considerable flexibility. That allows each local authority to ensure that the phased return is as safe as possible, something that, of course, remains a key priority. The precautions we are adopting include 2-metre distancing within secondary schools, at least until the Easter holidays, and face coverings in secondary school for all staff and young people, unless exemptions apply. In addition, all school staff in primary, secondary and special schools, and all secondary school students in year 4 to 6 will be able to take COVID tests twice a week. We're publishing data today showing results from the first 2 weeks in which lateral flow tests were available for school staff and for a small number of secondary school students who were in school. During that time, more than 36,000 staff and 3,000 pupils took tests. Very few of these tests were positive. The additional cases which were confirmed, which were all amongst school staff, show once again how testing can help people to find out if they have COVID even when they do not have symptoms. It therefore provides an additional safeguard as students and pupils and teachers return. Fundamentally, I know that the phased return will cause some difficulties for schools, for local authorities and for pupils and their parents, but it is the best way of ensuring that all secondary school students spend some time in school before Easter, something we all know is important, whilst making their return as safe as possible. The other point I want to make is about education, relates to college and university students in Scotland. As you know, a small number of further and higher education students are now returning to campus for in-person learning. Anyone who lives in Scotland and has to do that, and who is changing household as a result, can now request a test before they travel to their term time address. This will be a very small proportion of the total number of students, but it does offer extra reassurance for them and their fellow students that they will arrive on campus with a negative result. The tests for these students are PCR tests, which take longer to process than lateral flow tests, but which are more sensitive. So I would strongly encourage anyone who is returning to campus and who is changing households as a result to request a test. You can find out more details about how to do this through the Student Information Scotland website and NHS Inform. Ultimately, of course, the best way in which we can ensure a safe return for our university and college students and for our school pupils is to keep levels of COVID within the community as low as possible. One of the ways that we are increasingly trying to do that is by increasing our use of targeted community testing, particularly in communities where there is still a high prevalence of the virus. And that is the final point I want to touch on today. We have agreed proposals for targeted community testing with 20 local authority areas. So 23 testing sites have now been established across Scotland, which people can turn up to if they do not have symptoms. Over the next month, we will establish a further 24 sites. We've published data today showing that more than 10,000 tests were carried out on people without symptoms during the 5 weeks up to the 23rd of February, and just over 250 of those tests were positive. In those cases, targeted community testing has helped to identify people with COVID who would not otherwise have known they had the virus, and is a good example of how testing can help us to break chains of transmission within the community. That is something that will become even more important as we start to relax restrictions. Ultimately, however, the best way in which we can keep the virus under control at the moment is to stick to the current rules and guidelines. It's very clear from the data at the moment that things are heading in the right direction. New cases of COVID are falling, vaccination is starting to have an impact. But case numbers are still high, and we do still need to be careful. So for all of us, the most important rule remains a very clear one. Please stay at home. In any level 4 area, and that of course includes all of mainland Scotland, we should only leave home for essential purposes. Those include caring responsibilities, essential shopping and exercise. Please do not meet up with other households indoors. And if you meet up with someone outdoors, you can only meet with one other person from one other household. You must work from home if you possibly can, and employers have a legal duty to support people to work from home. And when we do leave the house, we should continue to remember facts. Wear face coverings when you're likely to come into close contact with other people, avoid anywhere that's busy, clean hands and hard surfaces, use 2-metre distancing if you're talking to someone from another household, and self-isolate and book a test if you have symptoms. Above all else, though, please stay at home as much as possible. By doing that, we can enable children to go back to school safely, and we can continue to protect each other, our loved ones and our communities as vaccination continues and as restrictions slowly start to ease. So please stay at home, protect the NHS and save lives. And as always, my sincere gratitude to everyone who is doing just that. Let's now turn then to our journalists who've joined us this morning. And first of those is Ross Govins from STV. Ross.
Afternoon, Cabinet Secretary. I wonder if you could update us on the efforts to trace all of those who were on the flight to Aberdeen, which was carrying those people who subsequently tested positive for the Brazilian variant. And can you tell us, in the time that's elapsed since that trio first tested positive, are you now satisfied that there has been no community transmission?
So I'll ask the Chief Medical Officer to say a little bit, particularly on the second part of your question, Ross, but what I can tell you is that from the 3 index cases, so that's the 3 individuals that we have spoken about before, there have been 249 close contacts contacted. All those contacts have been made and are completed. There were, as you'll recall, a total of 90 on the particular flight that came from Heathrow to Aberdeen that the individuals, the index case individuals were on. 3 of those 90 were flight crew. So far, 56 individuals have been contacted, and of course, through them, there may be others from that. And we are still looking for the remaining number. Part of the difficulty is where the data that we've been given has been incomplete, and so it's harder to track those individuals down. And so what we're now asking is that if you were on that flight on the 29th of January, that's BA 1312, then we're asking, and you've not been contacted, then we're asking you to call the National Contact Tracing Centre, the NHS Centre, on 0800 030 8012. So we'll continue, our contact tracing teams will continue to try to identify those remaining individuals from the flight. But if you are one of those individuals and you've not been contacted, then please call that number and let the contact tracing team do their job. On your other point, Ross, about community transmission, we are still satisfied that there has been no community transmission, but I'm sure Gregor will want to say a little bit more about the basis on which we have that confidence.
Hi Ross. Well, at this moment in time, yeah, we can be confident that there's no evidence of community transmission arising from these 3 cases just now. And again, I need to thank those 3 cases for the way that they acted when they came home, the way that they isolated, because that has helped prevent the spread that we would have been concerned about just now. The IMT will meet again this afternoon. They'll discuss the latest evidence. But at this moment in time, we're not seeing anything coming through at all that suggests there has been any escape of this virus into the local community. We'll continue to receive further test results back over the coming days, and as an additional layer of precaution, we'll be seeking to do additional genomic sequencing of the routine tests in that area as well, just so we can give an extra layer of reassurance in relation to knowing any degree of community escape just now. But again, I have to emphasise at this point in time, there is nothing to suggest that this has resulted in any escape of this variant into local communities.
Thanks, Gregor. Ben Phillip from BBC.
Thank you very much, Health Secretary. Just following on about the Brazil variant that's been detected in Aberdeen, obviously, as you say, 56 passengers are still, 56 passengers have been contacted, and you're still looking for the remaining number on that flight. I suppose, I mean, it can't be ruled out that there hasn't been any community spread of this variant until they're found. And I know yesterday you mentioned that there was also a connection to a local school as well. Can you tell us a little bit more details around that, please?
So I've already given you, thanks very much, Ben. Sorry, I should have thanked you. I've already given you the 249 contacts of the 3 index cases. So that encapsulates the second part of your question. And those contacts are now completed. In other words, the contact tracing work is complete, and all of that work is now done. I'm sure Gregor might want to say a little bit more about the 34 individuals from the plane that have not been yet contacted. I'm sure many of them, if they are still in Scotland, will be getting in touch with us through that national phone line that I've just read out, as well as our contact tracing team continuing to look for ways by which they can contact them. But remember, this flight was on the 29th of January, and Gregor will say a bit more about how we undertake a proportion of genomic sequencing on the tests that we do, all of which helps. It's not just one set of data, there's other streams of data that help us to have confidence levels about whether community transmission exists or doesn't exist. And all of that comes together to allow our clinical advisors to give us that advice one way or the other, or where there are areas of uncertainty. But I'm sure Gregor might want to say a bit more about that.
Yeah, thanks, Ben. I mean, attempts, the National Contact Tracing Centre are continuing to attempt 15 of the 34 who we know have valid phone numbers, and those attempts will continue at this point in time. Of the 19 who appear not to have valid phone numbers just now, what we've done is we've been able to link the details of those people back to the, again, we refer back to the Community Health Index and get what appear to be additional valid phone numbers from that, and more attempts will be made to contact those people as well. So those attempts are ongoing just now. It's right that we continue to follow that through just now, but at this moment in time, as I say, from the sequencing which has already been analysed in that area, we sequence probably between 5 and 10% of all positive tests anyway, plus some additional sequencing which we'll put in place at this moment in time. We're not seeing any evidence at all of any escape into local community at all.
Thanks very much. Now, Matty Sutton from ITV Border.
Thank you, Cabinet Secretary. We've been speaking to hospitality businesses in the south of Scotland today, and they're concerned about the impact of travel bans from between higher level areas and lower level areas, and from England. And one said they're unable to take payments for bookings for the summer because they don't have any clarity on whether they'll be able to accept those visitors. Just wondering what the Scottish Government's doing to mitigate the impact on business in areas likely to fall into lower levels from the end of April, but which rely on visitors from higher levels, potentially outside their area, to be viable.
Thanks very much, Matty. Of course, the rule at the moment is that none of us should be travelling anywhere and we should be staying at home. And any easing of travel restrictions will be decisions taken as the data gives us the information that may make that possible. So at this point, we all know where we are and what we've got to do, and that is not travel, stay at home, all those other things I read out. And the First Minister set out last week the steps we would take, provided the data allowed it, towards getting to a point later in April where we could move as a whole, we hope, as a whole country, out of the current situation back into the levels framework. And we've said that we're looking at what those levels are and what's permissible in each of those, and whether we need to tighten those closer to what the World Health Organization advises, and we'll set all of that out in Parliament in the weeks to come. In the meantime, of course, my colleague Ms Forbes, our Finance Secretary, has made a number of support packages available for different kinds of businesses across Scotland, including those who are self-employed, and will continue to look at what more she can do, including whether there is anything additional that is possible on the basis of what the Chancellor of the UK sets out today. So we'll continue to keep all of that under review. We're very conscious of the difficulties that our business communities are experiencing and of the need to support them as much as we possibly can, because we want our economy to build back and to become stronger. And many of those businesses, including those small businesses, are really important to that. So we've done all that we can so far. We'll set out the steps as clearly as we can as the data allows us to set out those steps. And the Finance Secretary will continue to look and see what more she can do. And with the Economy Secretary, Ms Hislop, they are listening all the time to what the business sector and the economic sector are saying to us about the issues that they're facing and the help that may be helpful to them. Lewis Meekie from Bauer.
Thank you, Health Secretary. As of the 5th of April, we now know that door-to-door canvassing will be allowed should COVID figures be at a certain level for candidates in the Holyrood election. But MSP Colin Smith says it feels like a bit of one rule for politicians and another for the public. And some of the public will be wondering why they'll still be living under so many restrictions, but politicians will be able to travel the country to canvass at that time. Do you think that's fair? And also, just on top of that, can you shed any light on, what kind of measures people who are canvassing will need to follow when they're doing so?
Thanks very much, Lewis. And I know Chief Medical Officer might want to say something about the restrictions and the mitigations around some of the important work around the Holyrood elections on the 6th of May. The place to start with all of this, of course, is that this is all a product of discussion with all of the parties, and that includes the party that Mr Smith is a member of. So it's a discussion with all of the parties on the basis of can we go ahead with those important Scottish Parliament elections. The Electoral Commission, of course, has a view on that. And if we can, knowing that inevitably it will be a different kind of election campaign, a different kind of election count of the vote, what is possible, provided the progress in suppressing the virus continues. And that's why there is that caveat around the date when it might be possible for political parties to engage in canvassing. But no one is suggesting that politicians should be travelling the length and breadth of the country to canvass. Canvassing takes place in your local constituency. That's kind of the point of it. And so there should be no particular reason why a candidate in one part of the country is travelling to another part of the country to canvass. And there are really clear mitigations in place, should canvassing be possible, that will try to ensure that it is done in as safe a way as possible. On your other point about does that feel fair to the wider public, I think there is general agreement that democracy is important in this country. The people of Scotland, the voters of Scotland, having the opportunity to express their opinion about who the next government in Scotland should be is really important. And that's why all the parties have come together to support the holding of those elections with all the caveats I've just described. And it's not yet been set out absolutely where everyone else will be around those dates in the run-up to the 6th of May. And as I've said to previous questioners, that will all be set out in the weeks ahead as the data tells us what level of room we have to ease restrictions and what those might be, whilst continuing the really important work of keeping the levels of the virus as low as we possibly can. Gregor, do you want to say something about the mitigations?
So that democratic context is really important for this discussion. And if we look at the figures across Scotland today, Scotland's currently sitting at a national figure of 80 cases per 100,000 7-day cumulative incidence. One of the things that in the advice that I provided in relation to face-to-face canvassing was that when that commences, it should be at an appropriate time that the kind of current infection rate across Scotland allows. And so it won't commence unless we have an infection rate which is below 50 cases per 100,000 and a positivity rate of below 5% across Scotland. Another caveat that relates to that as well is that in any area where the kind of rate is above 100 cases per 100,000, that face-to-face canvassing should be suspended as well. So there are safeguards, first of all, in place about whether it should take place or not. Once it takes place, there are again additional mitigations which can be put in place for anyone who's involved in that canvassing. It's really important that they're making sure that they take all steps to keep their distance. We've advised that the numbers involved in canvassing at any one time should be limited. Ideally, that should be no more than 2 people canvassing at any one area, but for the parties to decide and consider, given the various considerations about risk in terms of how many people need to be together so they're not working alone. But also, in addition to that, making sure that we're wearing face coverings, washing hands regularly, all the things that we would expect people to do, and maintaining their distance when any conversations are taking place. Other aspect of this, which is equally important for those volunteers who are involved in this, as it is for everyone across the country, is to be very careful about car sharing. We're still seeing an awful lot of cases which are associated with car sharing, and my advice is that in these circumstances, again, we should be avoiding car sharing to make sure that we're, again, reducing the likelihood of any possibility of transmission in that context as well.
Thanks very much, Gregor. Neil Pooran from PA.
Thanks, Health Secretary. On the modelling you might be doing around the impact of the vaccination programme in general, you might have seen there were some suggestions that the falls and death rates in England are actually happening faster than anticipated earlier on. You might have seen the story about it in the Telegraph today. Do you know if that's the case here in Scotland too? I know you mentioned care homes earlier, but are we still seeing that faster fall in deaths in the over 80s category as well? I don't think I saw that in any analysis of that anyway in the NRS data today. And if we still keep hearing that good news, do you feel you'll be able to go ahead with a faster easing of restrictions than we might have thought earlier? And for Dr. Smith, could you maybe update us on any analysis you're doing on the so-called vaccine effect, the rate at which deaths are falling faster in the vaccinated people as opposed to people who haven't had it yet?
Okay, thanks, Neil. I'll let Gregor pick up on your point about the impact of vaccination, potential impact of vaccination on death rates. And you're right, I covered a little bit of that in what I said at the start of the briefing in terms of what the NRS statistics are telling us this week, and we can trace that back over previous weeks. In terms of, is the vaccination programme potentially allowing us to move faster than we might otherwise have thought? I think it's worth remembering that there are a number of factors. There's no single piece of data that triggers you going quicker or slower. It is the range of data that we look at. And of course now, so that of course is prevalence, cases per 100,000, test positivity, over a 7-day average. Remember, that's really important. It's not single days, it's over the 7-day period. It's people who are being hospitalised because of COVID, numbers of people in ICU because of COVID. There is also important information about people who are staying longer in hospital who have COVID, and then the rate of vaccination and any emerging evidence about the potential impact of vaccination particularly on whether or not, if you're vaccinated, you can still transmit the virus to others, the transmissibility of the virus. That's really critical, and it's still the case that there isn't enough data to be completely confident about that, although signs are optimistic, and I know Gregor will say a bit more about it. That's one of the reasons. So there's a range of data that comes together that is used by senior clinical advisors, Gregor and his colleagues, to give politicians like me, the First Minister, advice on what they think is possible, what we might be able to do, what we ought to be more cautious about doing. But then the judgments and the decisions are made by the First Minister and her cabinet. So that's why we keep saying the data will drive this. And it's not a single piece of data, it's all of that together and the clinical advice that flows from that. So will we be able to go faster than we've set out? I would hope so. Everyone watching would hope so. I'm sure, Neil, you too hope so. But it isn't possible in advance of ourselves to say that. And that's why we have the 3-week period that was set out last week by the First Minister in order to be sure that any progress that we're seeing is sustained progress. It's not a blip, but it is sustained over a period, because that gives us more confidence that we are on a downward trend in terms of the prevalence of the virus in Scotland and our capacity to bring it down to lowest possible levels. Final point I'll make on that before I hand to Gregor is the point about bringing it down to lowest possible levels is, of course, fewer people are sick, fewer people are in hospital, fewer people are in ICU, and indeed fewer people will die. But it also means that as we ease restrictions, which themselves risk producing an increase in cases, we've got more headroom to do that. So it is complex. It's not complicated, it's complex, but I am confident over 12 months in that those who are tuning in to this briefing understand it very well indeed by now.
I'm going to start by picking up on that last point that the Cabinet Secretary explained there, because it's really important. When you begin a national vaccination programme, as we have in the UK, and that seeks to try to protect people, one of the potential risks at that point in time is that you begin to exert a greater degree of what we call selection pressure on the virus, because more people are becoming protected against the virus that's circulating. Then the virus tries to counteract that by further evolving and trying to escape the immune systems that are then able to combat it. So at this point in time, the vaccination programme by itself is exerting that selection pressure on the virus across the country. Now, if you do that when you've got very high levels of infection, it's much more likely to lead to further mutations starting to reveal themselves. So it's really important that alongside the vaccination programme, we continue to suppress the virus as much as is possible to make sure that we allow as seldom opportunity for the virus to further evolve and escape into this optimum virus that might still happen. Because we still don't know whether some of the recent changes that we've seen, particularly showing a lot of convergence around about particular mutations, particularly the 501 mutation people have referred to and the 484 mutation, is the virus almost evolving further and further so that it's best suited to the human host. Now, as I say, the vaccine programme is showing some really incredible, encouraging signs. I'm not sure I would characterise it as being faster than I expected to show some of the encouraging data that we're seeing in terms of hospitalisation and mortality. But it's certainly encouraging to see that that's already coming through at this stage. And we know that in terms of vaccine effect, that effect starts to become most apparent probably between about 3 to 4 weeks after that first dose, and it's a rising effect over time as well. So all that remains very, very encouraging. Now, as far as where we are with the data just now, Public Health Scotland continue to work alongside a number of different academic groups, developing that data and analysing it to see exactly the latest impact. As we get more and more data coming through from the expansion of the programme, we become more and more confident about the impact that it's having both on hospitalisation, where I think we can now be significantly confident it has a significant effect in the reduction of hospitalisation, and becoming more and more confident as well about the impact that is now having on death rates as well. The third aspect of this, which still we need more data on, is about the impacts that it has on transmission. But if we just take the example of the NRS data that's been published this week on deaths, and particularly the place where those deaths have occurred, 77% fall in care homes deaths in the last 5 weeks to the 28th of February, compared to 37% in hospitals and 60% at home. I think that is significant. I know we can't wholly attribute that solely at this stage based on that data to the impact of the vaccination programme. It certainly gives us confidence that something is happening there, which is adding an additional layer of protection. And I think it's reasonable to speculate that the vaccination programme has had quite a significant impact on that from the other data that we have as well.
Thanks very much, Gregor. Jamie Saunderson from Kingdom FM.
Thank you and good afternoon. Details came out yesterday which showed that the criteria that will be applied to the levels system will be stricter than it was last year. And based on current data, that would potentially mean that Fife would enter level 3 under the current rules as opposed to level 1 under the previous rules. If that were to happen, is there a risk that lockdown fatigue could become an issue?
Thanks very much, Jamie. The first thing I'd say about this, and I know Gregor will want to say a bit more, is what we're talking about here is moving the indicators closer to what the World Health Organization advised. And of course, we've often had discussions at these briefings about the importance of paying attention to what the World Health Organization says. And that's exactly what we're doing. I wouldn't leap to conclusions, though, automatically, that if that's what we do, then that's what that means for Fife or for my own area of Ayrshire or any other part of the country. The indicators from the World Health Organization are there to counter the increased transmissibility of the current dominant virus. That's what they are designed to help us with. But of course, what we're doing now in the current situation is moving in a stepped way out of where we are now, as the data allows us to do that, with the intention that as we get through into April, we'll be able as a country to move back to the levels framework, albeit slightly altered, and we'll set out what that will look like in the weeks ahead, but move as a country to different layers of protection and fewer restrictions. And what those might be, again, we'll set those out. And then move, if we can, to be more flexible depending on how different parts of the country are faring in terms of bringing down prevalence. All of it with the intention of then using things like asymptomatic community testing I talked about earlier, the increased rollout of the vaccination programme. Remember, we have said that supplies permitting, we intend to be able to have offered everyone over 50 and those with underlying health conditions and those who are unpaid carers a vaccination appointment by the middle of April. So the vaccination programme continues and will continue in its scale and its size right through. So all of that comes together to produce the evidence that then gives the clinical advice to the First Minister and her Cabinet about where we go, either as a whole country or as we move into back into the levels framework, whether there is a difference between different parts of the country, depending on what the data tells us. But Gregor may want to say a bit more about the WHO.
Yeah, the WHO produced these indicators in November, just so towards the end of the year. And since they were produced, we've been reviewing them, looking at our own experience with the levels, the metrics that we used within those levels over the course that we applied them. And particularly, they watched with very careful interest this growing proportion of B117 variant in Scotland. Now, I think the important aspect of this is that the B117 variant now accounts for roughly 90% of the virus that we see in Scotland. That's a wholly different situation that we face now compared to the one that we faced before Christmas, when that was just beginning to be introduced in Scotland and we started to see that rising numbers. Why is it different? It's different because the B117 variant, which was first identified in Kent, is so much more transmissible than the virus which we were used to dealing with. And that's why it's appropriate that we undertook that review of the indicators. And I think that there's a lot of sense in the way that the WHO have articulated their current metrics in order that we achieve a sustainable control of the virus. And I think that's particularly relevant when you're dealing with a virus that's approximately 30 to 70% more transmissible than the virus that we were dealing with beforehand.
The other point to make just before we move on to our next journalist is that we are anticipating that it is later in April that we will return to a levels framework. And we're anticipating that because by that point, we should be dealing, given everything that is underway, all the sacrifices that people are making across the country, that case levels are lower. So that should indicate to you that the levels that we would anticipate we're in are significantly less restrictive than where we are right now. And we will cautiously and gradually, as the evidence allows us, move that forward, as the evidence tells us, as I've said, but also as the vaccination programme does its work. Graham Mann from The Sun.
Yeah, good afternoon. This is a question for both the Health Secretary and the Chief Medical Officer. Are we in a stronger position now than we've ever been, where we can look forward to Scotland's 2 Euros fixtures in June with optimism that the Tartan Army will be allowed to attend Hampden Park in their thousands?
I'm going to let the Chief Medical Officer take that first.
Okay, so where are we just now? So as I said, the most important thing at this moment in time is that in Scotland we still have relatively high case numbers, particularly if you look at those WHO definitions of where we are, but we expect to see further improvement over the coming weeks and months. But as we begin to open up the country, that allows more people to come together. It exerts more pressure on the R number, which of course we know is one of the indications of the drivers of transmission. And as more people come together, there is the possibility that that more infections occur. However, we also need to balance that by the fact that we are going to have more and more of the population vaccinated during that time as well. One of the key things that is going to help us in the decision making as to what happens next is when we begin to get some of the data through on the impact that those vaccinations have on transmission. Now, I've said before, there's some encouraging signs that transmission is beginning to be impacted. There are some data which are beginning to come through that looks to give us some reassurance that it is having a positive effect on reducing transmission, but we need more data before I think we would be in a position where we would be able to make any judgment at all on something which is still, 3 months away just now.
Thanks, Gregor. Let me say a couple of things. Being part of the Euros for Scotland is a really big deal. And the point where we qualified for that was a cause of great celebration across the country and certainly in my own household. So I completely understand how important this is, what a great fillip and a boost it is, and how much fans and supporters of our national team would want the answer to your question, Graham, to be yes. Part of who holds the answer to that question is actually all of us. And it's all of us abiding by the rules, doing everything we can to make sure that the case numbers come down, the virus is suppressed. We try very, very hard at every step along the way towards that date in the summer, that we're trying to do everything we possibly can to make sure that the virus has no opportunity to transmit from one person to another. And when we are, as adults, called for that vaccination appointment, we take that up. Our intention is, again, supplies allowing, that we will have vaccinated every adult over the age of 18 in Scotland by the end of May. That is a really important and hopeful target to aim for. So if we can bring all of that together and the data continues to point us in the right direction, then we certainly should be able to celebrate our national team playing in the Euros, hopefully winning in the Euros, and we'll see whether or not it's possible at any point along that road for fans to actually be present to witness that. Let's move now to Helen Puttock of The Times.
Thank you very much, Health Secretary. I wondered if I could ask about hospital-acquired COVID infections. We had data for the first 3 weeks in January, but I wondered if you could tell us what latest data you have on the number of COVID-19 cases acquired in hospital. And could you also tell me how that compares then with other places of infection? So, for example, Dr. Smith recently mentioned car sharing. How does hospital as a place of acquiring COVID fit into those kind of common places where people pick up the virus? And finally, we know that patients who go to care homes directly from hospital are tested on discharge. What is the policy on testing patients who were admitted to hospital, particularly as an emergency, but not with COVID, testing them for COVID before they go home to other share households, particularly households perhaps where someone has been shielding? Thank you.
Thanks very much, Helen. Of course, you're right. The data that we publish on hospital or nosocomial infections, as it's called, has a 3 weeks time lag. There is more current data, which, if I'm right, I might be wrong about this, but if I'm right, I think is published today. And from what I have seen is an improvement in terms of the numbers or the percentage of what is described as definite or probable hospital onset of COVID-19. But we can make sure, we can double check that and make sure that we give you confirmation of that later on this afternoon. In terms of, and I'll let Gregor say a bit more about how it overall nonetheless compares with other areas where transmission is a risk. In terms of hospitals, we now have a policy, we've had it since the turn of the year, the back end of last year into this year, where all hospital admissions are tested, emergency but also planned, maternity as well. And we have regular testing for hospital staff, for NHS staff. All of that is designed, as well as all the other infection prevention and control measures and PPE and so on that our NHS staff do so very well, to ensure that we can minimise the risk of transmission into the hospital setting of the virus. Of course, that is always much more difficult to do when there are levels of the virus in the community that are high. As those levels come down, then the measures in hospital can be much more effective. On your point about discharging people before they leave hospital, in addition to those who are elderly or maybe returning to a residential setting, be that a care home or whatever it might be, we don't have a standard policy of testing everyone. Remember, they will have been tested when they came into hospital. Obviously, if they have acquired COVID or shown signs of COVID during their hospital stay, they will have been tested for that, and they won't be discharged until they are negative. But other than that, there is no policy as a standard of testing individuals before they are discharged, although clinicians are always the right people to make those decisions if they think that that is appropriate.
Helen, the last data that I saw in this showed that there was a reduction in the overall volume of nosocomial infections that we were seeing in the healthcare environment just now. How does that compare to other areas? Well, I guess it's one of the areas where there's still quite significant mixing between people from different places just now. So I don't think it will surprise you that it's one of the features that's, or one of the areas that features more strongly when we do the analysis of where people have been when they have tested positive. Of course, that doesn't mean to say that's where they caught it. It just means that they've been in that environment. They've been out. It's the same argument that we use with all settings. But nonetheless, there is an association there that is still evident that health and social care places or interactions are still an area where there is some degree of risk of infection at this point in time. But we have to make sure that that's understood as a proportionate, because given the volume of interactions that there still are across the country on a day-to-day basis in that setting, actually the proportion of people who test positive after such an interaction is absolutely very, very small compared to the level of interactions they have with other environments as well. So we continue to monitor that. It's an improving trend, but it's not something that we can be complacent about.
Thanks very much, Gregor. Just one point to say before we move on is just to remind us all that we are extending testing to primary care staff as well. So we've got our NHS staff in acute and hospital community settings, community hospital settings, now extended to primary care as well. Elsa Meishman from The Scotsman.
Thanks, Health Secretary. I wanted to ask about the vaccine rollout. The Scottish Government said 2 weeks ago that everyone in the clinically vulnerable group had been offered a first dose of vaccine, and 80% had taken it up. 17,000 or nearly 17,000 people have since been registered with the first dose in that group. Is that people changing their mind, or is that people who might not have been reached in the initial offering of first doses? And also, if I may, the First Minister told MSPs yesterday that the target for giving 400,000 doses a week had been exceeded. She said at some point when supply allowed it. I've not got a record of that, so I wondered, can you clarify when exactly that was? And are you also able to give any more information? She mentioned a possible further supply dip coming next week. Are you able to give any more details on that and what effect it might have?
Okay, so let me try and take each of your questions. The data I have on the number or the percentage of people who were classed as clinically extremely vulnerable, remember that's a different group of people from those that we're currently vaccinating, and increasing numbers of those who have underlying health conditions. Clinically extremely vulnerable, 90% of those on the shielding list have received their first dose. So we continue to reach people. We continue to have people come forward who may feel that they have been missed, contacting our national vaccination line or their GP practice. And where that actually is the case, then I can't think of another word to use it. Please don't take it as disrespectful. We mop those up. And that's a feature of vaccination programmes, a feature of our flu vaccination programme, feature of all vaccination programmes. We are really determined, and the numbers so far are significant, really determined to reach every single adult over the age of 18 as quickly as we can. On your second point about when did we actually it was just over 400,000 vaccinations in a 1 week. It was a week in February. I can't recall exactly what the week is, but we'll let you know what that is, and we can point you to where the data is. What that demonstrates, and if supplies were allowing, that's what we'd be doing this week, and that's what we would have done last week and next week. What it demonstrates is that we have the infrastructure to do 400,000 vaccinations a week in terms of sites, delivery logistics, vaccinators, support staff, volunteers who help us, coordinated by the British Red Cross, and my thanks to all of them for that. But it is supply contingent. And so there's been a dip last week in this. There may be another one. We expect there might be another small one next week. And then we have confirmation that supplies should increase thereafter. And it is because of all of that and the extensive modelling that is done constantly around supply and the numbers of people we have to reach that we remain confident that we will have offered the vaccination, first dose of the vaccination to everyone over 50. So that JCVI, highest priority group of people, those most clinically vulnerable to serious illness and death as a result of COVID-19, we will have got to that place by the middle of February and be running the second dose work stream, which from the numbers that we report every day, you can see is increasing already back into our care homes, where we quite rightly to give our elderly citizens the second dose of the vaccination, completing their programme. So supply is the only constraint, and that's the case across the whole of the UK. It's not special to Scotland. It is a case across the whole of the UK, and it's a constant source of discussion between myself and my colleague health ministers in the other three governments when we meet every week to talk about how we are dealing with the COVID pandemic and what are the next steps we need to take. So that's where we are on all of that. Good progress made, but good progress made thanks to two groups of people, all of those who behind the scenes and in the front line are engaged in delivering the vaccination programme, and all of those people who are coming forward in large numbers and enthusiastically to accept their first dose of the vaccine. And what I'd say to them is, when your second appointment comes, please come for the second appointment. That really matters, that second dose, to complete the programme. Gregor, I don't know if you've anything to add?
I think perhaps the only thing I would add is it's important to remember that group, the clinically extremely vulnerable, is not a static group, that it's a dynamic group that people are enter and are added to as clinicians assess them, and or as additional risks are identified. So more people have been added to that over recent times as well, and we'll make sure that those people who are added to that group, whether it be because a large group of a particular disease characteristic has been added, or whether it be a clinician individually adding a person to that group, is that we'll make sure that they are taken into the programme as well.
Thanks very much. Kate Foster from the Daily Mail.
Question about the vaccination programme. It does look as though this may now roll on for the next potentially two years or so, and I'm wondering what planning is going into place to kind of take care of that. For example, in terms of will that be something which is a rolling programme, or would it potentially be seasonal like the flu? And the facilities that are currently being used as max vaccination centres, might they be given over to the NHS on a more permanent basis? And also in terms of the staff, how will that be looked at? Thanks.
Thanks very much, Kate. There's two sides, if you like, to the answer to your question. It's an important question. So I'm going to ask Gregor to give us, from his perspective, where we are in thinking about how we might need to continue to vaccinate the adult population. And then I'll talk a little bit about any infrastructure planning that we are doing in order to deliver what might happen.
Two of the key points about what requirement there will be for an ongoing programme are to what degree does our immunity that the vaccine gives us, to what degree does that endure? So how quickly does that begin to wane over time? And by best estimates just now, we start to see a gradual decline in that immunity, probably of the order of 6 to 8 months just now. But that's, as I say, as far as we're tracking this just now. It doesn't mean to say that people lose immunity at that point in time. That's not the case, because the immune system is much more complex than that, and we retain a memory function as well that will still be able to attenuate the effects of any disease as well. But what we don't have yet is a full assessment as to how long that vaccination will confer immunity. And once we know that, we'll know exactly when booster doses may or may not be required. But the additional element that's now started to come in very strongly to the mix is about what are the impact of these new variants of concern that we're beginning to see. Because some of those have features in them that may mean it's more likely that those viruses can begin to show what we call immune escape, either away from natural immunity or from the vaccine immunity that we give through the vaccination programme. And again, more work is underway to try to understand exactly the nature of that. And I think it's reasonable just now at this point in time to suspect that there will be an ongoing need for some sort of vaccination programme in some form over the coming years. But what we don't know at this stage with confidence is what would be the interval between receiving, if you like, your primary course and any subsequent booster course, because that is very much dependent on how quickly other variants become apparent and established, and as I say, just how long that immune system is able to kind of retain its impact as well. But I suspect that vaccination against the SARS-CoV-2 virus is going to be something that we are going to be contemplating from this point, and particularly, and this is really important, particularly if we continue to try to follow a programme where we suppress the virus to as low a level as possible, not just in this country, but globally. Because if we can do that on a global basis, as we've done before with other virus illness such as measles, it means that what we're left to manage is outbreaks as they arise. And it's much, much easier to contain those outbreaks as they arise than the experience we have on a seasonal basis with flu. And those two options, those two constructs, I think are still available to us just now in terms of which one we globally choose to follow. But it means that we need to plan accordingly and make sure that we've got all the data that gives us the information necessary to assess how we would make sure we positively take the steps in order to make that happen.
Thanks, Gregor. And that sets the scene for my part of the answer, if you like, because if we work on what Gregor has described as a reasonable expectation, then the planning is underway to indicate, if you like, the scenarios underneath that reasonable expectation of a repeat of the current scale of the vaccination programme, 4.45 million adults in Scotland, at one end, to the possibility it may be a smaller number at the other end. It depends on all that evidence and information and knowledge that will come through people like Gregor to me and to us. But it is looking at, so what is it that we need to have as part of the vaccination infrastructure, if you like? Now, we already have a vaccination infrastructure in Scotland. We've got a good track record in vaccination, but undoubtedly we need to increase that. So that is about looking at the workforce, the core workforce of trained and experienced vaccinators that you can draw on. We have a core workforce, we've drawn on them for this national programme, but we've supplemented that considerably with others who are then trained and so on. But increasing the size of the core workforce, looking at where we do the vaccinations and how we might be able to manage some of those additional facilities, what we might need, and so on, as well as how do we improve and streamline the process. One of the two tools that we have created for this current programme, which really matter for any future programme, are the vaccine management tool, which allows data on who has been vaccinated, what the vaccine was, where they were vaccinated, to be entered almost instantaneously into a central database. So that then allows us to trigger second doses and so on, but it means we have all that data in one place. And what's called Service Now, which is really the centralised booking system that allows us to send out appointment letters and bookings, including increasingly through GP practices, that are managed alongside our expectation of delivery. So we are marrying the two together, the supplies that we expect in against the number of bookings that we send out and ask people to come forward. So those are all part of the planning using existing infrastructure that we've deliberately created in expectation that we'll need it going forward, but also looking at the different scenarios depending on the answers to the questions that Gregor has just outlined. And I should say that that forward planning also applies to our current test and protect system, our current system of both testing, but also of contact tracing. Because as Gregor said, you know, if we can get to a place like, as an example with measles, where what we are dealing with are outbreaks, small outbreaks, then we need testing and we need contact tracing so that small outbreaks don't become anything bigger than that, and we can capture the cases, ensure that there isn't community transmission, look after those who have the virus, and then move on. So a lot of forward thinking and planning well underway now about how we might expect to be living with this particular virus for some time to come. And our final journalist this morning is Georgina Hayes from The Telegraph.
Good afternoon, both. Next month, we're set to return to the level system, which is obviously in contrast to south of the border, where things are going to move at a national level. And I think many people might be wondering, especially as we get to the stage where there might still be cases, but hospitalisations and deaths are low due to the vaccine. At what stage we can expect to see an end to the level system in Scotland? The UK government gave the indicative date of June 21st, and I appreciate that you're reluctant to give indicative dates. But is there a certain threshold or range of data that the government would need to see before the system is lifted? Thank you.
Thanks very much, Georgina. I'm going to ask Gregor about basically what the World Health Organization guides us in this, and then I'll say a couple of things about what, as politicians and as the Health Secretary, I think.
Well, I guess within the construct that WHO have used within these indicators, it goes all the way down to level 0, which is as close to normality as we could, I guess, hope to get at that point in time. And by using the level system, what it allows us to do is to calibrate the response so that it's proportionate to what is happening in any particular area. That's really important when you've got such differing geography as we have in Scotland, particularly when it's difficult to compare the impact in the islands, in the Highlands, and particularly across that central belt. We've seen 3 different types of pandemic almost within those areas over the duration of the last 12 months. So retaining that flexible approach within that levels construct allows us, as I say, to get as close to normality as possible, but whilst still being able to maintain a vigilance that should there be any evidence of increasing community transmission, community prevalence of the infection, either from the virus that we've become known to or with the introduction of further new variants, we'll be able to respond accordingly. And I think that flexibility is really important and something which we will probably become used to for some time yet.
Thanks very much, Gregor. I mean, at the moment, we are on a national level. All of mainland Scotland is in the same place. And we've set out the steps that we think we can take, data allowing, to move to a place where we can return to a levels framework. And we want to return to a levels framework precisely for the reasons that Gregor set out, because we think that that is fairer, more proportionate, and gives greater flexibility. But the point about a date where we think we will all be significantly out of all the restrictions that are possible and closer, as people have described it, to a more normal way of living. We're not reluctant to give that date. It's simply that we do not believe that 3 months on, 4 months out, we're the 3rd of March, that we can confidently give a date. And part of the reason for that, we've just seen in December, January and February, where a new variant arrives that is more infectious, that gives us a requirement to increase levels of protection, to take steps. That's the thing about the virus. It's like all viruses. Give it half a chance, it will constantly seek to mutate. And so sitting here or standing here on the 3rd of March, it's not possible, in my opinion, to be confident and say to people watching, this is the date, mark that in your diary, that's the date when it'll all be fine, it'll all be over and we'll be in a different place. I would dearly love to be able to do that, but I don't think that that is the right thing to do, because I can't do it with any confidence, and I don't think that people want a date from me just for the sake of having a date, when they know fine well that it's not one that is data-driven, it's not one that I can be confident about. So much as I'd love to do it, it's not something that I'm going to be able to do. There will come a time when we will be able to say, we're moving closer, we're moving closer, we're moving closer now. But right now, on the 3rd of March, it's not possible, much as I'd love to, as I've said, to be able to give a date when we will be much closer to what any one of us would consider a more normal life. So that's it for today. My thanks to all the journalists who've joined us. My thanks to Yvonne, our BSL interpreter, to Gregor for joining me. Most of all, though, my thanks to all of you for taking the time to join us again today. The signs are giving us cause for cautious optimism. They are improvements. The vaccination programme is going well, and we're seeing improvements in the number of cases, and importantly, in the impact, potentially the impact that the vaccination programme is having. And that is all down, in truth, to all of you and all of the sacrifices that you make every single day, as well, of course, to our frontline NHS, social care and public service workers. The one thing we can all do to help them is continue to abide by the rules. Hard though I know, I absolutely know, hard though that is. The most important one of which, for now, is please stay at home. And when we do go out for those essential purposes, please remember facts. Face coverings, avoiding crowded places, cleaning hands on hard surfaces, maintaining 2-metre distance, and staying at home, isolating and booking a test if you have any symptoms. That is working. We're making steady progress. We all want us to continue to make even steadier progress all through the coming weeks, so that we can get to the better place that we all want to get to. For now, we stay at home, we protect our NHS, and we save lives. Thank you very much indeed.